Hello, everybody. Hello, people. It's Gifty here, Midwife Gifty. Hope you're doing well and all is well with you. Happy Diwali to anyone celebrating. I know it was yesterday, but I'm sure people are still celebrating because I still hear some fireworks where I live. So definitely people are still celebrating. In today's live, I'll be talking with you about how to advocate for yourself as a pregnant person during your pregnancy. So, when you are pregnant is a time where you are really excited, you're looking forward to everything that's about to happen, whether it's your first time or especially when it's your first time. You're not sure about things, how things will go, you're nervous, you are anxious, there's so many emotions. But one thing that does come to mind as soon as you start to see the healthcare professionals is, some anxiety over how things will go, how you're going to be giving information, how do you take that information, how do you make sure that everything that you are going through, you are experiencing everything the right way, how you can communicate your concerns, your worries, um, how you can make sure that you get the right care, the best care for yourself, no matter where you are. So in this live, I want to just discuss with you about how you, as a pregnant person, can um, advocate for yourself, and of course, your partners can also advocate for you. Your family members can also advocate for you. Anybody that is with you, who's on your side and helping you get through this whole process, can advocate for you. But in order for them to advocate for you, number one, they must know what you want. Because at the end of the day, this is all about you. Okay. This is your care, is your baby, is your family, your experience, that we are all here to support you as a midwife, or as when you do see your doctor, what they're going to be doing for you, how they're going to care for you. It is about you. So you have to make sure that you are the center of attention. Everything revolves around you. So therefore, you must be able to advocate for yourself. If there's something that's going on that you're not happy with, if there's something that you are experiencing that you want to know more of, you want to know less of, you want to, have more support, or not, the lack of support is stressing you out, is worrying you, you must be able to say that, okay? You must be able to speak up about it and feel empowered and feel really, really happy to talk about your experience. You have to be able to say, no, I don't want this, or no, I want that, or I want to experience more of this. I need more information about this. I have a question about this and I'm not happy with the answer that I've got. I want a second opinion. So please, you have to always make sure that you are feeling like, the care that you're receiving during your pregnancy at all points and at all levels and at all gestations are correct and is right for you. Hello there, thank you for joining the live. So I'm talking today about, if you've just joined, I'm talking today about how you can advocate for yourself, or how to get people to advocate on your behalf as well when you're pregnant. It is a very vulnerable time in your life, and it shouldn't be in a case where you're feeling so vulnerable that you are feeling like things are being done to you, rather than you feeling like you are doing things that are with your consent. You are given the information, you have done your own research, you can feel, comfortable and confident enough to come to your healthcare providers and say, I want this, or I don't want that, or this is what I need, or this is not what I need. It's very, very important that you are feeling empowered throughout your pregnancy. And there will be some times where you're feeling nervous, you're worried, you're concerned. Maybe things will change from you being low risk to being high risk. But, at any time at all, you have to feel confident and, feel empowered enough to feel like you're getting the right care. And if you feel like things are not going right, you have to be able to say, no, this is not right. I demand more. I want more. I want a second opinion. I want to have this done. Okay. Don't ever feel like things are being done to you without your consent. Don't feel like things are being done to you without you feeling in control, feeling like you can't say anything, feeling like you have to just do or go along with things, because these things will make you feel really, really demotivated. It will make you feel out of control. And the worst case scenario, it will give you some, issues with your mental health, bonding with your baby at the end if you didn't feel empowered to do things that you wanted to do, or you feel like things were done to you. So this live is to just give you some tips on how you can do things so you don't ever feel like your decisions were taken away from you, or you feel like, things were done to you rather than with you, or you feel like you were given the right information for you to make the right decisions. And don't ever feel like you have to do things because that's what somebody wants you to do. That's the one thing that you don't ever have to do, okay? So I've got some notes here so that I don't miss anything out. I'm going to go through the different parts of your pregnancy. So I'm going to break into 3 areas, which is your antenatal period, which is where you are pregnant to the point where you go into labor. Then I'm going to discuss things about labor, when you are in labor, what you can do and how you can feel empowered to be able to advocate for yourself, or how others around you can advocate for you. And then at the end, when you've had your baby and you've gone home, hello, Lucy. I'm going to discuss about, what you need to do as well postnatally when you've gone home, and then the care, slightly changes because you're going into community settings, and how you can feel empowered as well as, feel like your care has been smooth right throughout, and you don't get shortchanged in any part of the journey. Okay, so when we're starting from antenatal, my first point here that I've put down is to make sure that you are going to your appointments with either a relative, or you're going with your partner, or you're going with your family member, somebody that you feel you can be, you can rely upon, you can trust. These appointments are going to be quite personal. They're going to be quite private to you as well. So don't take anybody along with you that you don't want them to know your information, especially your private information. So please make sure that you go to your appointments with somebody that you can trust, that you feel like they can be there and be able to advocate for you if they were ever needed for advocation, tips or jobs or anything like that. So please make sure that you are going with somebody. It gives you a lot of, empowerment. It makes you feel comfortable, confident. It takes away a little bit of the nervousness away from your appointments, because some people will come to your appointment feeling really nervous, thinking, I don't know what to expect, what's going to happen. So they may come and not feel confident enough to speak up. But if you bring somebody with you, they may be able to just say some things for you. They may be able to ask a question on your behalf, so you may feel more relaxed if somebody else is with you. And therefore, that will help you to open up more and to ask questions, okay? So always bring somebody with you, unless they've said, don't bring somebody, or you feel like you want to talk something privately with your care provider and you don't want anybody else there to hear what you're going to say. Then, of course, make sure that you are keeping your private things private as well. What I would like to also say, another point, is that please don't feel shy, okay? Don't feel shy to say or ask questions, or feel like, I don't want to talk about this, or I'm feeling a bit nervous, I don't want to say. Even if you're feeling nervous, just say to the person, the care provider, I'm feeling nervous, but I do have a question. Is it okay if I ask my question? There is no question that is too silly, that is too, unnecessary, or too small, or too big for you to ask. If it's a question, it means you need an answer to it. Don't leave your appointment with more questions than you came with, okay? So if you have a question, don't be shy, ask your question. These are during your antenatal period I'm talking about, okay? Another tip is that if you are not sure of something that the person that you're seeing, let's say, I'm going to base this on, say you're seeing a midwife. If your midwife is saying something to you and you're not sure, or you're not sure what it means exactly, don't assume that you think they said what you think they've said. If you are unsure, don't assume anything, because this is going to be in a situation where it may affect your care. It may affect what you need to do at home. So ask the question. Say, sorry, do you mind just explaining this more? Or can you repeat that again? Or how can I do that? What is the best way to achieve it? Don't just hear something which you know within yourself that you're not sure or you don't understand, but you don't want to make it awkward, or you feel like, oh, I don't want to ask because I don't want them to think that I don't understand. If you don't understand something, please ask. As a midwife, we're here to empower you. We are always for you, okay? We want you to feel empowered, or me in particular anyway. I'm going to speak for myself as a midwife. I want you to feel empowered. When I see my women and their partners, I want them to feel empowered. I want them to feel like they understand what I'm saying to them. If I give them something to do at home or something to research, I want them to go and know exactly what they're going to do. Okay, and therefore, if they come to me next time, they will not come to me with the same question that they've, asked before, or tell me that they didn't understand something, and now you've had a whole, few weeks go by where you didn't understand what I said, so that you've missed an opportunity to research something. So if you're seeing your healthcare professional and you are not sure of something, don't go away. Just ask the question. They'll be more than happy to explain. Okay, so don't leave without asking your questions that you are unclear about or unsure about. Okay. Another tip is to make sure that you go to your appointments on time. I can't stress how hard it is to try and squeeze a half an hour appointment into like a 15-minute or into like a 10-minute because you came late. Okay. Please make sure that you give yourself enough time to get to your appointment. It is very, very important you get there on time because it's good for you. You want to make sure that you utilize all your time that is booked for you. If your appointment is half an hour long or an hour long, we want to give you your full hour. We're going to make sure that we're there on time so that we can bring you the information you need, or we can make sure that we're coming to take care of you as best to our ability as possible. If you give us less time, we can't do what we need to do. Okay. Or we may have to rush things. We may rush through things and you will feel really rushed out. It's not a great feeling when you come to your appointment and because you're late, you can't get your questions answered, or the midwife is telling you, oh, I'm really sorry, you have to finish your appointment because now I've got another person waiting outside. Another thing that is an important reason why you have to come to your appointment is that it's not fair on the next person who's also after you to have to wait for you to ask your questions. So your time now is going to run into their time. Now, everybody has a life. They have their own, appointments to keep. They may have somewhere to be, and therefore they cannot afford to be late for their appointment. They cannot afford to be late leaving their appointment. So please make sure that you are taking full responsibility in getting to your appointments on time, just so that, you get all the information that you need in order for you to know the information you need to know. Okay, no information is useless in pregnancy. You have to know more than what you think you're going to need. Okay, it's better and important for you to know more and not need it than to need it and not have it. Okay, so make sure that you go to your appointments on time with yourself ready, everything you need. You get there in time. They may need you to do things like maybe, take a urine sample where you have to collect it whilst you're there. You may have to have your blood pressure checked before you see the midwife. Make sure that you give yourself enough time to get there and get all these things done. So when you go to the midwife, you are on time. Even if the midwife is running late, but you were on time, she will have to give you your half an hour. If it means her apologizing to the person after you to say, I'm really sorry, but I'm running late, but you're going to get your time. Okay. So make sure that you are going to your appointments on time. Do not be late for your appointment on time. It's also really, really distracting to the midwife when they're waiting for you and you haven't come on time. Okay, it really is. It breaks their concentration. It breaks the focus that they're in. If they're in a rhythm of really running on time, it really messes them up because now they're thinking whilst you're there and they're talking to their mind is on the person who's sitting outside. Okay, so if there is an answer for your question, they may not be able to go into more details as they should do if you had been on time, if their mind was not on the person waiting outside. So it's very, very important that you come to your appointments on time. I cannot stress that enough. It's going to help you to get the information you need in order for you to feel knowledgeable enough to advocate for yourself. Do you understand? It makes sense, right? Right. The next tip for your appointments for advocating for yourself is to make sure that you go to your appointments with some questions. Okay. So many times I see women in my clinic and I'm like, do you have any questions? And they will say, no, I don't. There is no way you do not have questions. Maybe you've forgotten about the question, which can happen very often, but you have to make sure that if you have a question when you're at home, when you are in the office, when you are taking a shower, you come out your shower, you write that question down. Okay. If you're doing something with your kids and you remember, oh, I need to ask the midwife this question when I go to my appointment, write it down. You are going to forget so easily when you're pregnant. Okay. Because of the baby brain or the hormones, like I said in my last video or another video that I've made, you are going to forget things. Okay. So write things down so that you don't forget, because if it's not written, you're most likely going to forget it. Go to your appointment with some questions. At least 2 to 3 questions is very, very good to have. try to keep your questions within the gestations that you're in. Okay, so for example, don't come to your 12-week appointment. Let's say it's your first appointment, right? And you're seeing the midwife for the first time. The appointment is quite long. There's going to be loads of information sharing, gathering of information from you, from your partner, and putting in, on the system. There's so many things happening in your first appointment. Don't come to this appointment with a question like, can I give birth in the water, or can I book a water birth? You are nowhere near that point, okay? It's not necessary, it's not important. You are going to get answers to this question, but it's not the right time to be asking delivery questions when you're just getting started. I know it's exciting, you might want to know, it might be an anxiety thing on your mind, but just pace yourself and ask questions relating to that point that you're in. So if you're 12 weeks coming to see your midwife for your first appointment, a question that you may ask, just on the top of my head, you may ask a question like, what is the things that I should be experiencing right now? Like, what are the normal things that I should be getting? What is normal and what's not normal? If I'm seeing this, then she can explain to you, okay, at this 12 weeks gestation, we're not expecting to have any bleeding. If you see bleeding, you have to go to hospital. These are questions that you need right now, okay? So tailor your questions to the time that you're at the gestation that you're at, so you're not feeling overwhelmed of things that you don't have to worry about for some time, okay? And therefore, you can have the questions that you actually do need, the answers to those questions right now in the time that you're in. So live in the moment and make sure that you tailor your questions to the point that you're at, but make sure you take some questions, okay? Get yourself a notebook. This is a good tip. Get yourself a notebook just specifically for your questions that you may have, and also for the answers that they will give you. All right. So make sure that you are asking questions. You're taking the answers for the questions into your notepad. Like I said, you're going to forget it if you don't write it down. So just do your best to write things down. Okay. Another thing that I'm going to tell you to help you to advocate for yourself is that you have to take responsibility. Okay. When you are pregnant, of course, we are excited for you as a midwife. We're looking forward to looking after you and caring for you and your baby, making sure that everything is okay. You're getting the right appointments, you're getting the right visits, you're getting everything right. But the responsibility lays with you. Remember, you are not the only patient that your midwife or your doctor is seeing, okay? We see so many women. I've got a clinic tomorrow that I'm working. I'm going to see 14 patients, okay? 14 in a day. Okay, so you are not the only one that we're going to see. We are also human. Look at us as humans, okay? We're just doing a job, okay? We love our jobs. We're good at our jobs, but it's still a job that we have to do, and we have to take it very, very seriously. It's our responsibility is very huge. We have a responsibility to you. We have a responsibility to your baby to make sure that nothing goes wrong, okay? But you are the pregnant woman. Your baby's with you, okay? You have to make sure that you are taking responsibility for yourself and for your baby. If we're giving you information such as your next appointment is on this date, this time, this location, it's your responsibility to remember to come to that appointment, because we're not going to call you again to say, remember your appointment is tomorrow. You may get a text message, or, in some cases, some email, or you might be on an app where it will remind you, but you have to make sure that you are reminding yourself that you've got an appointment. If you miss an appointment, it's not up to the midwife to be chasing you to say you missed this appointment. We will definitely call you and say, look, I was expecting you. Where did you go? But you know what? Life happens. You may not pick up. You may have forgotten your phone somewhere, and we might not be able to get you on the phone at that moment to make sure we reschedule your appointment. Then the midwife's clinic might be over. She may send you your details to somewhere else to get an appointment booked for you. Or she might book you an appointment, but it might be too soon, like you may not get a letter in the post before the appointment. This is your responsibility to make sure that if you miss an appointment, okay, you call and get yourself rebooked. Don't leave it up to somebody else. It's your appointment, it's your care, it's your baby. You take that responsibility on yourself, okay? Another thing to take responsibility for is that you have to make sure that you are chasing things. We will get back to you when we say we're going to get back to you, for sure. But again, we see hundreds of patients every single week, okay? If you're working full time, you may see, in a month, you might see up to, I don't even know the numbers, but it's a lot, okay? If I'm seeing 14 in a day, and if I'm working, let's say 4 days a week, you do the maths, it's quite a lot in a month. So if you are missing something, if you need to chase something, make it your priority. Okay, you chase it, you come back to us. Don't wait for us to come to you all the time. We will come to you, but don't wait for us to come to you all the time, because we are not here for just you as the patient. Okay, we have many patients and we have the same responsibility levels to each and every single one of our patients. Okay, we love you all the same. We don't love one more than the other. So please make sure that you are chasing things, you are responsible, you are taking full responsibility for everything that's going on in your pregnancy. Don't leave it just up to the midwives. Okay, so the next part to this is just making sure that you are going there with an open mind, feel happy, don't stress. And if you are stressed, you're going to speak this out. Okay, you're going to advocate for yourself. You're going to tell the midwife what the problem is, how you're feeling, and what it is that they can help you with. Don't be afraid to tell the midwife, I need you to do this for me. I need this, I need that. And if they can do it, they will do it. If they can't and they need to pass you on to another department or another team, this is exactly what they will do, because they have that responsibility to do that. They have that to, they owe you that. It's our job to make sure that you are okay at all times. In every appointment that you see, whoever you see, okay, is our duty of care. We've signed an oath, okay, to say we're not going to do any harm to you. We're going to look after you. We're going to make sure that you're okay. You are our priority. So when you're with your midwife, when you're going to see them, you are their priority and they're there for you. So if there is anything that you want them to do, don't be afraid to ask. It's absolutely okay to ask for help, okay? And this is going to help you to be more confident, to be able to say, listen, I'm not happy with this, I need this, or I need more of this, okay? Right, now I'm going to move on to the second part, which is the intrapartum. Intrapartum meaning when you are in labor, okay? So let's say you've gone into labor and you are there with your midwife, okay? I'm going to base this all on the midwife. So you're a low-risk patient, you're in labor, you've gone into spontaneous labor, meaning your waters are broken by itself, or you've gone into labor yourself, and now you've gone and you've been admitted. How do you advocate for yourself in those situations? There is going to be times where when you get admitted, you're going to feel really nervous. Of course, it's really, really normal for you to feel nervous, for you to feel worried, but you don't need to be. Again, the midwife is there for you. We are going to be advocating for you in terms of maybe if the doctors want to come in to do something or they want to have an update, we're going to talk for you on your behalf. We're going to say, okay, my woman is at this centimeters, she's doing really well. She's contracting this many times in 10 minutes. I'm happy. You don't need to come in here. We're good. If I need you, I'll call you. As midwife, this is our job, okay? We are the queens or the kings of normality. So if as long as you are normal pregnancy, normal baby, everything is okay and there's no abnormalities, we're not worried or concerned about anything, we're not anticipating any issues, you are going to be looked after by a midwife. And in that case, a doctor doesn't need to see you, and that's okay. Okay, so if you need us to advocate anything for you on your behalf, we are more than happy to take that and do it for you. All right, so make sure that you are not feeling like you are going to be left alone or everything that's going to happen, you have to deal with everything. We are absolutely on your side, okay, as midwives. If you have any questions, please do not feel like, oh, now I'm here, so they will know everything and everything that they say is gold. Okay, remember, like I said, we are human beings. The doctor's human, okay? The midwife is human, just like yourselves. It's just that the roles that we're playing is different. But we will reason with you, we will listen to you, be open-minded, and if you are not happy with something, please speak up, okay? If you're not happy with the midwife looking after you, you're not sure that you're getting on, or you are, there's anything that you feel is just not working for you, or I want you to know that you can actually ask and say, can I have somebody else to look after me? Okay, you can do that. It's within your right to say, I'm not happy with the midwife that I've got, I would like somebody else. And the ward manager will try and give you somebody else. They have every obligation to get you someone else as long as they are able to do that. Okay, they may be, okay, hold on, we're going to swap your midwife, but we have to wait for somebody to finish their lunch break. So therefore, your midwife has to stay with you until the person that can take over comes back to you. So please just be advised that you can do this. It is in your right to say, I'm not happy with who I've got, or we're not getting on, or it's just not happening. Can I just have somebody? It doesn't have to be anything negative. Okay, it can be just as simple of, we're just not getting on, or we're just not gelling. I'm just not feeling her. And that's okay. Or him. And that's okay. If you get a male midwife and you prefer to have a female midwife, it's absolutely fine to request that. Do you know what I mean? It's absolutely fine, because we want you to be at ease, okay? At your best, because that's what's going to help you to progress in your labor. And that's what's going to help you to release the right hormones and to stay calm, to help you get a best outcome. So if there's something troubling you, please speak up. Know your rights, okay? Make sure that you are well informed, you do research, you go to your classes, and you are well informed. Feel confident to know that, no, I don't want this doesn't feel right, and that's it. Okay. Another way that you can know how to advocate for yourself, or how you can advocate for yourself, is to try and see what's happening and ask for time. Okay. If there's a big decision that you have to make, as long as you are okay, your baby's okay, you can ask to be given time to think about things with your partner, or to call somebody to ask, to call somebody to reason with, to call somebody to just give you a second opinion, or anything like that. You can be told, you can tell people, or the doctors or the midwife, say, you know what, give me some time, let me think about this, or I just need time to process the information that you've just given me. Another thing to say is, you can advocate for yourself and say, look, what you've said doesn't make sense to me. Can you explain it in like layman's terms, meaning just without all the medical terms, just explain it to me in the most lowest form of, like, just pretend you're speaking to someone that doesn't know anything. Okay, so that they can break things down to you and get it in a form that you are able to understand, you are able to process, and you are able to make a decision. Okay, don't feel like you have to understand all the medical terms and the names and the abbreviations and all of that. And if you don't know it, that's a bad thing. No, it's not. If you don't know something, some of the abbreviations, as midwife, we're like, what does that mean again? What does that stand for again? We're asking ourselves, or we'll ask the doctors, what does that actually mean? Like, you see something written by the doctor and you're like, what does that mean? Like, what does this, AGV stands for? What does this CPM stand? Like, you don't understand. And we're not just going to assume that we think we know. We're going to ask. So the same goes for you. If there's something being said and you don't understand, you're not sure of it, like I said in the beginning, don't assume. Don't think you know it. So therefore, I'm just going to think that's what that is, or that's what they're meaning to say. So I'm just going to go along with it. Please don't do that. If you need a second opinion, let's say a doctor comes to you, says something, and you're like, no, I need a second opinion, and I don't understand how you said it. Please ask. Ask the person and say, look, can you get somebody else to come and explain it to me? Because the way you are saying it, I'm just not getting it. Okay? Please, if you're here still, thank you so much for staying. If you like the live, please push the like button, touch the thumbs up. Okay, give me a thumbs up. And also, if you haven't subscribed to the channel, subscribe to the channel. If you want to share the live, I'm sure you can. Share it to other people. If not, when I finish this live, I'll be posting the recording again. So it'll be here for people to come and rewatch. Or if you want to share it to somebody else, you can share it later on when I post it up as a video. So anyway, back to the video now. So please be open and be unapologetic if you're not happy with something. Don't say anything. Don't say yes. Don't say no. Just say, give me some time. I need to think about it. Another thing that I will give you as another tip for when you are in labor. So if you and your partner are two people that speaks just, your only language is, say, English, and you're in an English speaking hospital and everybody around you speaks English. What I always tell my patients is for them to have a secret code. Okay. I'm going to explain the secret code to you. It's so important. It's so vital for people to feel empowered, for people to feel like they're not being judged, or they're afraid sometimes to say things, or for the partners to do things, especially for the men. Okay, sometimes you feel like you don't want to leave your partner because you think the midwife or the doctor might think you're leaving, or you are going off, or you're sleeping too long, or you may think that we're judging, which we absolutely are not at all. But this is your perception, and that's okay. So I'm going to give you a tip to help you combat that situation, okay, where you feel like you need to say something to your partner, but you don't want to say it in front of the doctors or the midwives, or your partner wants to say something to you, but the doctor's there, the midwife is always there. They're not going to leave your side. So you feel like, I don't want them to know. Or, I see some couples that will say, we're going to just do text messages. So they're texting each other. But imagine you're in labor as the woman and having a baby, you're contracting. And right at some point, you're like in so much need of wanting to tell your partner something, but you don't want anybody to know. You're not going to get your phone to try and concentrate on a text, okay? So it's going to be very difficult. This is what I mean by this secret code. What this secret code is going to be is absolutely between the two of you. But what it is that you're going to come up with a code word or a saying or a comment, which is going to indicate to your partner, okay? And in the terms of this video of advocating, for you, the person giving birth, when you say, let's say your code word is, I want a pineapple when I finish all of this, or I can't wait to have a glass of champagne, okay? To the midwife looking after you, let's say, for example, I'm the one looking after, I'm in the room with you, and I'm in my little corner, documenting, writing along, and all of a sudden, you say to your partner, oh, I can't wait to have champagne when we finish all of this. I'm just going to take it as, oh, that's nice. Yeah, that's a great idea. You deserve it, right? But to your partner, it's going to mean something different. For you, in order for advocation purposes, this could be the conversation you have. And you can have several of these codes, okay? Not just one. If you say the champagne word, your partner knows that means I need to go right next to my wife or my partner, and I need to make sure that I am making the decisions for her. She's absolutely had it right up to here, and she's not coping. She needs me. Okay, so when you hear her saying, I can't wait for all of this to be over so I can have some champagne, okay, action time. Like, I need to go to her wherever you are, or if you're next to her, that she's not coping. What do you need to do? Do you need to advocate for her? Do you need to talk for her? Do you need to tell the midwife, can you give us a moment? We just need a little moment. Like, she just needs a little bit of whatever. You need to have these, okay? It's very, very important that you are able to tell your partner in not so much words or in ways that you don't feel you're being heard of or listened to, that you need help, or you need their support, or you need an extra help, or you need them to come to your rescue. It's so, so good, okay? And for your partner on their side, let's say, for example, your partner smokes, okay? He's been with you for about 12 hours. He hasn't had a cigarette. He's feeling like, I don't want to go out to say, or I don't want to tell the midwife, oh, I'm going out for a fag, or I'm going out to have a smoke, right? But he really needs it because he's just had such a long hours and lack of sleep. He just needs a little fag break to, re-energize him again. Now, the way you can help advocate for him is for him to say to you, oh my God, like, I can't wait to eat that banana cake we cooked. You haven't cooked any banana cake, but to us, it's a banana cake he's cooked. To you, as the person that is with, you are going through the labor and your partner's saying, oh, I really need that banana cake. That code or that, sentence can mean to you, I'm really tired. I need a fag. I need to recharge. I need a cigarette break, and I need it now. Okay. In that moment, you as the partner can say, you're not saying anything to the midwife. Okay. You're not saying anything to the doctor, but you can make that your opportunity to say to your partner, oh, babe, do you want to go out and see if you can find us something to eat? Go and find me a snack from outside. Don't worry, I'll be okay. The midwife is here with me. Just go and help yourself and see if you can find us something. I'm feeling peckish. I need something cold. Go and see if you can buy me ice cream from the shop. Okay? Do you understand this? This is how you can, advocate for each other without anybody feeling like they're getting judged, or they're feeling, vulnerable, or they're feeling like something is not right. So just yes, exactly. You can say, midwife, are you able to step out? Definitely. So this is the kind of ways that you want to try and support each other. All right. And it's a nice, comfortable way, no judgment, nobody knows what's happening, and that's it. You just get on with it. And this is going to be so much more, relaxed environment. Everybody's getting some time, everybody's getting what they need, and you're feeling really, really well supported, and advocated is happening. Like, advocation is happening, your partner's there, you're feeling well and involved, and it's going to make him feel really involved. He's not going to feel like, he's leaving you. He's going for a quick cigarette break, so he's not going to be that long. So whatever's happening, you can emotionally and, mentally, what he's doing. Do you know what I mean? So you are okay with it and you know he's coming. You're reassured. And again, this is going to help you in labor. So you're not, stressing, you don't have any anxiety, and you are able to produce the right hormones. Okay. Your body's producing the right hormones that you need in order to progress in your labor. Okay. So I'm going to move on to the third point, the third area, which is the postnatal period, how you can advocate. So postnatal period is when you've had your baby, so everything is gone well, you've been discharged and you've gone home. Okay. In the UK, when you go home, the community midwives will come to you the day after you've gone home. So your postnatal period is going to be between us seeing you between day 2, day 3, and it can go up until day 28. Okay. Sorry, I'm really sorry if you can hear the fireworks going on outside. It's really loud. So forgive me for that. But if you go home and your midwives are now coming home to see you, you can also need to be advocating for yourself. Okay. Sometimes you can need it even more, because if you've had a traumatic birth, or things didn't go according to plan, let's say you wanted a water birth, but you ended up with having your baby, in a delivery suite, this might have caused you some anxiety, some heartbreak, feeling like you didn't do what you really wanted. These are the times where you can talk to your midwife. So feeling like you can talk for yourself is very important, because if I come home to you, your mental health is one of the biggest reasons I'm there. Okay, I'm there to make sure that you are coping well, that your birth was okay. There's nothing hanging over you. You're not feeling like you were left alone, or you're feeling like something was done to you that wasn't right. You're not feeling like, if anything like this happened, you have to be able to communicate it with your community midwife. You must be able to say and speak it out, because we can help you. Okay, we can help you, we can listen to you. Even sometimes just listening to you is going to make you feel better, feeling like you were able to say your piece, you were able to tell somebody else that will understand, that will see what it is that you've gone through, will appreciate your struggles or even your joys, is very, very important. It helps you with your mental health. You feel like you've been heard. You feel like, somebody else understands, and you feel like you were able to express yourself. So please, please make sure that you are talking for yourself when your midwife comes home to see you, that you are not feeling like anything or something is silly, I don't want to mention it, or, I can't mention it. Don't feel like that. Please be really open with your midwives when they come to see you postnatally, and also ask questions. Another point is to ask questions. Don't let your midwife come and see you at home and then they go and you're full of questions. Okay. It may be that she may not be able to answer the call straight away if you were to call her after she's left, because maybe she's going to see the next person and you don't know how far the next person is to your proximity. So she may get there really quickly and therefore she can't answer your call. So please make sure that you are asking questions when your midwife comes to see you. If you are not able to ask the question, or you're feeling shy, you're feeling vulnerable, whatever you may be feeling, if you have a family member in the house, make sure that they're in the same room that you are at with the midwife. Okay. If your partner's there, make sure that they are in the room, that they're also going to hear the information the midwife is going to give. They may also be able to ask questions on your behalf. Okay. They may be able to ask questions that you haven't even thought of, something that they've noticed about you. They may be able to ask and say, well, I've noticed that my partner has been feeling like this, or she does this when this happens. Is that normal? Okay. Remember, your partner might also have some anxiety. He may have seen things that he didn't plan to see in your labor. Okay, if you know what I mean. He went down south instead of staying at the top end, and he's now being shocked a little. He might also have some questions that he wants to ask and also get the answers to, so that he can also feel relaxed and feel heard. And this is also going to help his mental health in order to be able to support you in the long run, and not feel like he's still thinking about things that happened maybe 2 days before. And also he can get things reassured to him to say, okay, yes, this is normal. I know it's hard, and it's hard to watch somebody being in pain or not coping with something, but it's okay. It's normal. This is what you can do to help. So it's very important that they're also there. Somebody's around you to support you, to ask questions for you, to be an advocate on your behalf. Okay. So make sure that people are with you during your appointment, that the midwife is coming to see you at home at that time. The last point that I've got on this, I didn't have many on this because it's very, very personalized to the person that we're going to see. But the last tip that I have here is to ask your community midwife to show you things. Okay, if there's something that you wanted them to show you, such as, how do you bath the baby, we're not going to be physically able to give the baby a bath, but we can talk you through it. We can tell you the main points and things like that, so you feel empowered. You feel like, okay, I'm comfortable and I know what I'm doing in order to do this. There is a video that I've made on my channel regarding how you bathe the baby. Okay, it may sound simple, it may be something that you've never even thought of how you're going to do. You just think, well, I'm going to do it, right? So when the time comes, I guess I'll do it. If you want to know how you can do it and do it safely, I do have a video on my channel about how to bathe your baby. So please go through my channel and have a look at that video in your own time, and then learn some things from it. But be okay to ask for demonstrations, to ask questions about how to care for your baby. We're not expecting you to know it all. We don't even know it all. Okay, so we are all learning, and it's okay to ask questions. So if you don't know something, ask your midwife to explain it to you, to demonstrate it to you, to give you more information on where you can get more research on it and how you can get more information. Okay, so please, please, please don't be shy. No question is too small or too big. And if we're not sure what it is, we're always going to find you somebody else that can answer your question. Okay, I hope you have enjoyed this live. Thank you so much for everybody that joined and liked. And once it's posted, please do come back and rewatch it if you want to watch, or come back and share it to other people that you think will find this video useful. And I will see you in the next live. I am thinking of maybe doing an extra live in the week. So to make 2 lives a week, because I do have so much information to share. And I just want people to get the knowledge and the information that I feel is really useful and people are asking for. Okay, so I'm maybe doing another live on maybe a Wednesday or Tuesday night, or maybe during the day. I'm not quite sure the timings yet, but I will put it on my post to make people aware when I've decided which day and which time I'm going to do it. So if you do want to join my live and you want to know when I'm on, please subscribe to the channel and put the notification bell, so whenever I come live, you'll be able to see it. And if I do videos, I post 1 video as well every week. Normally I post it out on a Wednesday. So if there is anything that you would like to for me to discuss, or for me to talk about, or for me to show, then do please leave it in the comments box below, and I'll be more than happy to. Thank you so much for joining the live, and I will see you in the next one on Friday. But if I'm doing it sooner than that, I will post it so you will know. Thank you so much. Have a lovely, lovely day and a lovely weekend. And again, happy Diwali for people that are still celebrating and enjoying your fireworks. Take care, guys. Bye.